Hello and welcome. My name is Dr. Martina Assad, and I'm the CEO and the owner dentist of MA Dental. We are located on Marsh Air Base, close to the base on Riverside in Van Buren, California. And today we are going to be talking about emergency dentist. So, what is considered a dental emergency? And a dental emergency is pretty much an emergency for your tooth. It does depend on what you need. It could be bleeding, could be pain. It's usually pain, swelling, or both. Loss, tooth loss, crown loss, veneer loss, an issue with your implant or your implant crown, or an issue with your denture, something broke. So it's an emergency for your mouth. When we talk about type of emergencies and what situations, how do we handle each situation? So there are three different situations and what a patient can experience. The first one is, when do I seek an emergency dentist? Obviously, when you're in a lot of pain, when you're noticing quite a lot of bleeding and there's an emergency, but not to the point that is life-threatening. When you lost a crown, lost a veneer, your denture is broken, you can't function, you can't go out to social gatherings, your implant is loose maybe, or your implant crown is kind of popped out, you lost your retainer or night guard. That type of a thing, you do need to call up an emergency dentist, and we are very fast on getting you in. So please do not hesitate to call us. We'll accommodate you. Doesn't matter what time of the day it is, we will try. Our team is really, really great about accommodating patients for like really emergency dentists. Matter of fact, we're known for drive-through dentistry. So great quality drive-through dentistry. What I mean by that, a patient can come in for a broken crown. If you rush your case with an excellent quality, you have your crown 2 days later. And same thing like broken denture, same thing like the other day I had a patient who is about to get out from start to eat their food again, and they are going to take their feeding tube out, and their family loved one brought them in the other day, and then we started them with the denture process the day of, because in a month they will be eating again, so we will be giving them their denture way before their feeding tube is out. So that's situation number one. You seek an emergency dentist in those type of situations addressed above. The other more extensive situation, which is, when do I need to seek the emergency room? And the answer A, when the emergency dentist is not available. Please do not wait. Sometimes some of these situations can be life-threatening. The biggest thing I see with emergency rooms, when the swelling is too severe. When you're swollen right here, you definitely need to see an emergency dentist. Now, day two comes in and the swelling is kind of merging up to the eye or going down to the neck. You do not even hesitate to go to the emergency room, because at that point the swelling is not contained, and the pills that we're going to give you sometimes don't act fast enough. And at that point, any dentist in my position would tell you to please seek the emergency room for an antibiotic shot, and of course, obviously, pain med shot of some sort. And after that's resolved and the swelling is gone down, you definitely need to seek either an emergency dentist if your dentist is not available, or you can seek your own dentist. But life emergency and a swelling close to the eye or the neck, that is so severe, especially with children. They have a lot of low resistance to swelling. So it is very, very important for parents to be alert. And so as the patient, if you're swollen for 6 days straight, and it's not going away, please go to the ER. Do not wait. Not even an urgent care. ER, please. You do not need to wait. And that leads me to the third type of situation. If you're missing out on your recares, or if you have not seen your dentist in a while, just because you don't have any issues, that doesn't mean there's no such a thing. If you haven't had your yearly exam done, if you have not had a checkup in a while, your dentist definitely is a place to be. Also, for emergencies, you can feel free to seek your own dentist, but if they're not available, usually emergencies happen really quickly, and on a situations where your dentist is not available, or if you're very unhappy with your dentist, you're more than welcome to seek a brand new dentist, and we're here for you. So what are the common types of dental emergencies? And we kind of addressed it a little bit in the previous question, which it could be an emergency in the oral cavity of some sort. It could be bleeding, it could be loss of a crown or veneer, broken dentures, broken partials. It could be a loss of an implant, loose crown, It could be a loose tooth, a big one, swelling, pain, grinding, clenching. Sometimes are considered an emergency given the conditions for the patient. A loss of a night guard, loss of a retainer, loss of your aligners, Invisalign, it's a big one, loss of a bracket. They're all considered as emergencies. A cut, an ulcer, a sore, anything that pertains to the oral health. Sometimes headaches can be considered an emergency, and you go to your physician, you forget to check with your dentist. Headaches are a big one. So, any of an emergency of some sort, anything that will affect your function on a daily function, you can't speak, you lost your veneer, it's a problem. Please take a dentist, your dentist, if not, definitely an emergency dentist. And again, we're here for you. When do emergency dental extractions come in place? And the answer, when the tooth is very loose, like you're actually touching your tooth and it's going with you, like back and forth, like the wind, is you definitely at that point, possibly you need an extraction. When the tooth have broken all the way down to the gum line and you cannot even see what's there, that's possibility of an extraction. When you have a severe swelling on, like your face is kind of blowing up to the point that the tooth is, again, too far gone, that will possibly require an extraction. Emergency root canals. Why do you might need one? Usually people get emergency root canals when they're in severe pain. That's the common denominator for emergency root canals or root canals in general. What gets the patient actually to go is pain or swelling. So if you're in severe pain, like pulsating pain, something that you're taking pain meds on the clock and it's not going away, at that point, it's have passed to the point of not getting a root canal done or possibly even an extraction. So it's usually requires some sort of a really really urgent visit to the dentist. But again, when it comes to root canals, it's at the point of a cavity of no return. It's the point past the point of restoration that we have to really get to the nerve, get rid of that nerve, so you get rid of the swelling or the pain. So do we offer same-day care? And the answer is absolutely we do. Just do not hesitate to call us, and then we will fit you. Sometimes have to go on the weekends to fit patients in, so it does depend, and we do have weekend by appointment too, so it does depend on the severity of the emergency. We will fit you in at least to figure out what's going on. We'll take care of you, whether it's pain medications, whether it's some sort of a temporary restoration, whether it's like the actual treatment. It does depend. Every patient is different, but we definitely do same-day treatment a lot, actually. Could I schedule late hours appointment for the initial consultation? It is absolutely possible. Just whenever your time permits. Usually it's better to address the emergency before it happens. So you do not want to wait. If you're having some sort of pain that comes and goes, that it's definitely time for you to see the dentist, or you haven't seen a dentist. It's a great idea not to wait until the emergency situation happens, just to avoid you being in a pickle, especially before you travel or before you have a gathering or before you have an event or before you have a wedding. It is very, very important to visit the dentist regularly. But again, we will fit you in the day of as much as we can. If not, definitely the next day. Feel free to call us today. And with that, today that ends our video. I'll be more than happy to welcome you in the office. So is my staff. We're all eager to meet and greet new patients, get them out of pain, get them comfortable. You can definitely feel free to call us back at 951-327-7247. I'll be more than happy to schedule you. Have a great day.